So Ian, do you want to take us live, and then I'll start the meeting bang on 10. Yeah, I think we're ready to go. So Ian, can you confirm that we're live? Okay, excellent. Good morning, everyone. Welcome to the Part 1 South West London CCG Governing Body meeting. So we are broadcasting this meeting live, but we're also recording it, so it will be uploaded onto the South West London CCG website following the meeting. Welcome to all the committee members, and welcome to all attendees and any members of the public who are watching. So we do have a section, agenda item 10 on the agenda, where if we get questions from the public during the course of the meeting, we will endeavour to answer those questions, assuming that we have time. I've got apologies for the meeting from Dr. Dino Pardinani, who is the GP Borough Lead for Sutton. I've got apologies from Pippa Barber, lay member and QPOC chair. Apologies from Ian Dodds, the Director of Children's Services, and apologies from Asia Yunus, London-wide LMC rep, but we have, I believe, Nicola Rice joining us as a deputy for Asia. We have the declaration of interest. It's available in everyone's papers. Can I just check at this point in the meeting, are there any new declarations of interest or anything that I need to be particularly aware of for items on the agenda? No? Okay, I'll take that as accurate. For those watching, on our website, we do have a glossary and acronym buster that people can refer to. However, we will all endeavour to speak in intelligible English and to avoid acronyms wherever possible. I know that we're not always brilliant at that in the NHS, but we will try and do so for our own benefit as well as those watching. So can we confirm, Ben, that we are quorate for the meeting? And Yvonne, can you just confirm that for me?
We are, Andrew.
Excellent. Okay, so let's proceed with the meeting then. The first main section of the agenda is to look at the minutes of the last meeting. So can we go through those for accuracy, and I'll go through page by page. So page 1 of the minutes of the last meeting, page 2, page 3, page 4, page 5, page 6, and that's it. So I'm assuming from the lack of hands and comments that people are happy that's an accurate record of the meeting. Yeah, so I'll take that as an accurate record of the last meeting. Are there any matters arising from the last meeting that we're not covering in the agenda today that anyone wanted to flag up to me at this point? No? Okay, I shall proceed. So we go straight on to the Chair and Accountable Officer reports. I think there's 3 main items in the report, so 2 from me and 1 from Sarah. I'm not going to read them through. I'm taking all the papers in this meeting as read, so I'm assuming that people have prepared for the meeting, they've had a chance to read through the papers, so we're not going to go through all the papers or documents. What we will do is, if necessary, pick out any pertinent items, and particularly where there's a decision to be made, clarify what that decision is. But I'd like to devote the time to questions and comments and discussion rather than rehearsing what people have already had a chance to look at. So I'm taking this report as read, but just to pull out that the 3 things in there. First of all is the South West London and Surrey renal service reconfiguration proposal that is being worked up at the moment. There's nothing for us to decide on in this meeting, but it's important that people are aware that that is going on. There's also an item just flagging up what has been going on in the Community Engagement Steering Group, and then Sarah has given notice around the annual general meeting as well. Sarah, is there anything that you wanted to add to what's contained in the report?
Yes, just very briefly, just to highlight the fact that yesterday we had the Queen's speech, and just there are a few things in there for the NHS. One was the continued vaccine programme. There's also the recovery, which I know we speak about regularly, and the new health and care bill, which they have have clearly set out that they will be taking through this Parliament. They have not yet given us detail on social care reforms, but have flagged it as an area that they will want to look at. And the focus on the health and well-being of the nation is forefront. So I thought it was, and also just an area around mental health and well-being, which is also focused in the Queen's speech. I just wanted to flag those areas. It is worth going to have a look, but that happened yesterday.
Thank you, Sarah. Helpful. So any questions for myself and Sarah on what's contained in the report? I've got a hand. Let me just, in fact, two hands. So Susan, let me come to you.
First, just to say, because I chair the Community Engagement Steering Group, and I'm pleased to have a report there, but perhaps we could discuss offline where this is best placed in the agenda in future, whether it's going to be a regular occurrence, and then we could feed it into the report section of the meeting.
Certainly, Susan. We'll make sure we coordinate around that. Liz, you've got your hand up.
Yes, thanks. It's in relation to the renal services. And at the pre-meeting yesterday, the 6 health watches asked for further briefing on this, because we understand that it is a very large-scale development of services, that it affects patient flows considerably, particularly we understand in Croydon, and also a large number of patients in Surrey. So we would welcome some briefing on this particular topic outside the meeting.
Thanks, Liz. No, to confirm, it is a substantial service change, and we will need to go through the right process for that, including public engagement around any proposed changes that come out of the piece of work. Is there anything further that you wanted to say about that, Sarah? I mean, obviously in the report we've set out the next steps.
Yeah, no, I mean, we're not yet at a stage where we're ready to go and consult and engage yet, but I'm happy to think about how we involve our patient groups across South West London, and perhaps I'll have a work with Charlotte outside about the best way to do that as a kind of pre-engagement process, but we will try and do that as soon as possible.
Thanks.
Thanks, Sarah. Any other questions about the report? No? Okay, so that's for noting. So thank you for noting that. Let's go straight on to the item on vaccinations. So we've got both Matthew, who I think is due to present, and Tonya here. So the real experts who can answer any questions that we've got around the vaccination programme. As I said, Matthew, not expecting you to go through the pack. Do you want to just pull out any highlights?
Thank you, Andrew. Very happy to. And if I miss anything pertinent, Tonya, who has jointly SRO'd this with me, I'm sure we'll fill in the gaps, and of course happy to answer questions. In terms of just some quick headlines by way of introduction there for Andrew, I mean, overall positive progress. We're obviously open to the first 10 cohorts now. We're expecting later this week perhaps further information about the 11th cohort. We're at the moment over 40s, so the next age group down may be notified later this week. In terms of our take-up rate amongst those cohorts, I mean, it's, as it says in the report, between 85 and 90%. That has increased since the writing of the report. That was the end of April data. So we continue to steadily go in the right way. Obviously, some of those cohorts are at very high levels. Some health and care workers and some of the at-risk categories, harder to reach, are a bit lower than that. Relatively speaking, across London, we fare well, but obviously it's not really a competition about across London. It's about trying to make sure that the vaccine is available and provided to as many people as possible. And to that end, we have mitigations in place for those areas where there are, challenges in terms of take-up rates. Really, they are confined to making sure that the access is strong and varied. So we have a whole range of things such as the pop-up clinics, the use of religious leaders to help us engage specific conversations between health professionals and others with groups across South West London. And it's both important to have general communication about this, but also very specific targeted communications as well, and Charlotte and the team have been helping us to do that. So going forward, the challenges are going to be to maintain the progress on those cohort uptakes, to roll the programme out to the final cohorts, make sure second doses get done. Obviously, all of this in the context of the vaccine supply is slightly affected by what happens internationally, and we have to respond to that, and have done, I think, well so far. And keeping the staff who are involved in this, whether they be primary care, who have put in a huge shift on this, but also the large centres, pharmacists and the hospital hubs, make sure the staff are being supported in this process. And then I would say my final point, Andrew, is we're also putting some time now to, so what does the medium to longer term basis of this look like? Because vaccination is unlikely to be done when we've done the first 2 jabs for all of the cohorts. There is likely possibly to be a booster programme. We've got the flu vaccination programme as well. And so Tonya and I, with the new appointment, are talking about what infrastructure we need across southwest London and what mechanisms we need in place to maintain what has been a remarkable programme, but one that we need to make sure is now in a more business as usual footing going forward. And that's the other piece of work that we're doing, as well as obviously keeping the focus on the vaccination programme itself. So that's probably it by way of a brief introduction, Andrew. There is clearly enough information to fill the whole of this meeting on vaccination. I suspect we have other things we need to cover, so I will stop now.
Thanks, Matthew. Really helpful. Tonya, is there anything that you wanted to add to that? No obligation, but I'll give you the opportunity.
No, I think just expanding a little bit on the forward view and the opportunities the programme gives us. So as Matthew described, we have recently appointed South West London a director for COVID-19 and flu immunisation, because that is such a high priority for South West London to secure and continue to deliver. And also the opportunities we're starting to have conversations about making every contact count, and how we can start to use the opportunity of immunisation for things like SMI health checks, other screening opportunities. So I think we will build on our experience. I think the COVID-19 vaccination programme has really illuminated for us those areas we need to focus on in terms of health inequalities, but also I think the innovation around delivery we will now be able to take into other service areas. That's the only thing I was going to add.
Thanks, Tonya. Very impressive, I think, what we've achieved. So I do just want to take the opportunity to recognise that, how well we have done in this crucial bit of work. Any questions or comments for Matthew and Tonya? Susan?
Yeah, just to congratulate everybody on fantastic pieces of work that everyone's doing, working so hard. Just to say that we received, there's a report about the younger cohort insights. We had that at the engagement steering group, and really pleased to see that, we've got such strong borough level engagement groups now who can then take some of that data and build it into the great work that's been done locally. I just had one question, was with obviously some of the big vaccination centres now going back to their old jobs and closing, does that have any impact on some of the challenges in terms of meeting the demand that we've got for vaccinations?
So the short answer to that, Susan, is yes, they will, because as you say rightly, Crystal Palace will want their bar back, Harlequins will want their space back, etc., etc. So we have an estates work stream looking at those facilities that are potentially going to go back to their previous use, what we've got already in place amongst the other delivery mechanisms. So, for example, we have a big centre at Queen Mary's, Roehampton. We have some in NHS space that is more controllable, Hawks Road, etc. So they're looking at what's there, what's potentially not going to be there, and therefore what gaps or challenges we might have. And that's a piece of work that's going through the vaccine board. It's not concluded yet, but you're right to spot it. We have done the same, and we are just following that through at this moment. Obviously, coverage is key, so it will be part of that, how we make this a sustainable, future-proofed work stream. Facilities, access, etc., will all be part of it. So yes, short answer to your question.
And Nicola, in your primary care lead role, do you want to come in?
Yeah, thank you. So I suppose just to say it's not about estate going back to normal, it's a bit about workforce going back to normal as well. So, 60% of vaccinations have been done in a sort of general practice organisation in the PCN local vaccine sites, some of which were in NHS estate and some of which not. So there's kind of clearly overlap in kind of what the issues are. General practice is incredibly busy now. And so we've got the challenge of working out what the next bit holds, through the autumn is to what extent we still draw on general practice, where a lot of patients have a preference for attending, versus making sure we've got the right access across all different geographies, communities. I think it's going to be a really challenging time, but we've got such a great basis from which to build.
Thanks, Nicola. Any other questions? No? Okay, thank you. That was for noting. So really helpful update and really encouraging to see what we've managed to achieve. Not underestimating the challenges ahead, but as Nicola said, we've got an incredible base to build on, so really well done. Right, let's go on to the next item, which is back to you, Matthew, but this is different. There's two things we need to approve as part of this proposal. So again, I'm taking it as read, but maybe you could just sketch out what we're being asked to approve.
Very happy to do so, and I'm joined by two colleagues who I hope are now with us. So that's Daniele Serdos and also Rachel Flagg. And I will briefly introduce the item. I'll then ask Daniele, who's very close to this, to explain the specific ask that we're making of the governing body this morning, and then myself, Daniele and Rachel are happy to take any questions. People will also be pleased to know that I'm first two items, that's not continuing throughout the agenda, so I'll give plenty of other people space for the rest of the meeting. So in terms of the PIC service, this is an integral part of what we have in Croydon as our integrated model of care, and really importantly a big part of what we call our integrated community networks plus model, which we've started in Thornton Heath, one of the parts of Croydon, and are now rolling it out across the whole of Croydon, where we bring a variety of agencies together to provide integrated services to the population, whether that be health, social care, the voluntary sector, mental health, etc. We have had Age UK as the lead agency on this particular part of our programme for some time. There are, we believe, real benefits in continuing with the current provider, because, as I've just said, we're rolling out ICN Plus across Croydon at this time, and therefore with that and other change and of course recovery from the pandemic, we think the benefits of continuing with the current provider, who we are very pleased with in terms of their contribution, means that this is something that we would support and recommend, and hence we're asking the governing body to support it. But if I hand over to Daniele briefly now, he'll go through that in a little bit more detail, just a couple of asks that we've got, and then, as I say, we're happy with Rachel to take any questions.
Yes, thank you, Matthew. So what we're asking governing body today to do is to approve the recommendation of this paper to award the incumbent provider an interim contract for 12 months with the option of extending for a further 12 months using a direct award route. And the paper outlines the rationale for this recommendation. This will give us an opportunity over the next 12 to 18 months to review the service requirements and also develop a longer term strategy for the contract. So that's the first ask. The second ask of governing bodies to agree the publication of a contract award notice, which was included as an annex to the papers, to ensure that we are open and transparent with the market about our assessment that this provider at this moment is the only technically capable provider to deliver our strategy for integrated care in Croydon and the delivery of the model of care. So those are the two key asks of governing body today.
Thank you very much. Really helpful to set that out. So shall I open it up to the board for any questions on that and any concerns about what's being proposed? David?
And so to note, Andrew, it has been through the Finance Committee and the Finance Committee approved that. The point I think we made was one that Danielle has just made, which is the long term of the contract. And I think that's the important thing that needs to come out of this. So rather than just doing it 12 months and then extend, it's the longer term. So, but with that, we the Finance Committee did approve that.
Excellent. That's really helpful to know. Thank you, David. So any other questions on this? Any concerns? No? Okay, well, I'm going to then ask the board to do those two things. First is to approve the recommendation to award an interim contract to Age UK Croydon for 12 months with the option to extend for an additional 12 months. Are people happy to approve that?
Yes.
That's a yes, so that's approved. And the second is to approve the publication of the contract award notice. So can I again check with the board that we're happy to approve that? Yes?
Yes.
Good, so that's approved.
Thank you.
Thank you very much, Matthew and your team. Thanks for coming. And hopefully you've got the answer you wanted.
We have. Thank you very much. We'll crack on with the work. And David's point about the longer term is well made and absolutely will be a focus for us as we move forward. So thank you to the board, to the governing body. Great.
So straight on to committee updates and reports. There's a fair few different committees to report back here. Paul, you're going first, maybe by virtue of the fact that audit starts with the first letter of the alphabet. So you've got an update for us. There's also something for us to approve as part of this item, isn't there, which is delegation of authority?
That's correct, which I think Ben is going to just quickly share that paper in a moment or two. But thanks, Andrew. I've just got, as you say, two papers to quickly run through. So the first paper is from the last substantive audit committee, which was the 9th of March. And just quickly to note the items of obviously interest and assurance for the governing body. We went through the updated conflict of interest policy and approved that. We recognised obviously with the changes underway, we requested bring that back to committee later this autumn to start to understand the impact of the ICS arrangements and just ensure we understood that. In terms of standard documents, the external audit plan for 21-22 was approved, as was the internal audit plan. We also noted the single tender waivers, that they are signed off at finance, but we reviewed those and gave some feedback to finance committee just to include some additional information there. And then I think finally the other key item was a document required by our external auditors called the Informing the Risk Audit Risk Assessment for South West London CCG. That's a document myself, Neil and James worked on and shared that back to the auditors. So that was something new this year in terms of the level of detail we had to go into. So that was the agenda that we went through back in March. And then, as you just referred to, we had a further committee on the 22nd of April. Now, this was to go through the annual report and draft accounts. So it was joint chaired by myself and Charlotte, sort of helped us through the report as well. And even at that stage, I think it was a draft. It was still 170 pages long, so a lot to get through. But I think, you know, everybody was very comfortable with the content and how it was set out. There are a few minor recommendations to take back, which I believe were taken back to the borough leads and others to update. So we signed that off in principle at that meeting. There was a little bit of additional work to be done over the weekend in terms of the remuneration report and the updated draft. And that was then submitted on time on the 27th of April. So as you can see now, going forward, there is a timetable to close this document down. So we're expecting feedback this week. And I'm not sure if Neil or James is on the call, whether anything has come through as of this morning. That will be fed back through to Chair and SMT to review and incorporate. We then have another meeting on the 25th of May, where we'll look at that final report and the draft accounts. And that gives us a period of about 15 days, Andrew, to make any changes. We then have a formal sign-off on the 10th of June. And that should ensure that the submission to NHS England on the 15th of June, any final amendments, changes will be incorporated. As you can see there, we then bring that back to the governing body in July, and ultimately the annual report will be published in September. So that's the process. And I know, Ben, you've got a paper which is to formally approve delegation to the audit committee to sign off the annual report and accounts, and we'll obviously come back to that in a moment. But happy to take any questions. And Charlotte, if Charlotte's on the call, I don't know if there's anything you wanted to highlight from the process of compiling the annual report. But that's it from me. Otherwise, Andrew, happy to take any questions.
Thanks, Paul. Charlotte, is there anything you wanted to say?
I suppose just to thank the audit committee, because I suppose it was 6 annual reports, into one, and the audit committee did read indeed the 176 pages, and it was incredibly helpful to have those comments around consistency of language and kind of bits of kind of information that we'd omitted. So just to thank the audit committee really, and we'll obviously keep working on it.
Sure, thank you.
Thanks, Charlotte, really helpful. So at this point, any questions for Paul on anything contained in the audit committee report outside of the annual report and accounts? No? So Ben, do you want to just flag up to us exactly what's being requested? Because I believe clearly approving the annual report and accounts is a function for the governing body, but we do have the ability to delegate that to a committee, and I think that's what we're being asked to do. Do you want to just spell that out for us?
That's exactly right, Andrew. I think everybody said most of it. So it is a power that's reserved to the governing body, but it's common practice for this to be delegated down to the audit committee. And as Paul has said, obviously the audit committee has gone through this in all of the detail around it and provided the assurance back to the governing body. So really this is just to ask if everybody is happy to approve that delegation to the audit committee.
Okay, so before I formally ask the board to approve that, can I check if there are any concerns about that? No. Okay, so let me ask the question. The board will be happy to delegate authority to the audit committee for that purpose. So yes. Okay, so that is approved. Great.
Thank you.
Thank you everyone involved in that, and we will get the annual report back to the board, so we'll have an opportunity then just to, I think, flag up the incredible work that's not just gone into the report, but that sits behind the report that we're telling people about in that document. So we can look at that at the next governing body meeting. Right, straight on to finance. So David, over to you.
Thank you, Andrew. You've got the summary of the meeting of the committee on the 30th of March. We've since had a subsequent meeting on the 27th of April. Just to pick out just the one item, you've got there the items that we've actually approved. It's the third bullet point where at the meeting in March, we approved an interim budget. So at least we had a budget before we got to the 1st of April. But we've subsequently at the last meeting approved the budget for the first half year. So that was approved at the last committee on the 27th of April. I'll leave James to pick up the detail of that when he does his report. But happy to take any questions.
Thanks, David. So any questions for David on the content of the report that he has referred to? No. Okay, so let's go straight to James then. James, do you want to just quickly talk through some of the key issues from the finance report?
Yeah, I'll keep it very brief. For last year, as the paper outlines, as a CCG, we delivered a break-even position for the year, which is good. And we're going through the audit process at the moment, and as highlighted, we'll bring the annual report and the accounts back. As a system, as a South West London system, we had a small surplus overall of about 2 million after you'd made a couple of technical adjustments. So again, everybody was on balance or marginally better, which is a good result given the upheaval we've had through the year around the financial regime. So hopefully that sorts out last year. For this year, as David highlighted, we've approved the budget at Finance Committee, which we just bring in for final approval here. As people are aware, we've got a rollover for H1, so it's only a budget for the first 6 months. We've now issued budgets to all providers and boroughs, and last week, as part of the planning process, we submitted a balanced plan for this year. In terms of what's going to happen in the second half of the year, we don't know for sure, but I would put my money on being a similar sort of a process for the second half of the year in terms of a rollover. I know Treasury and the department won't conclude discussions until late summer, early autumn, so we won't know numbers until later in the year. But I would bet on that being the outcome. So happy to take any questions, but as I say, we just need to formally approve the budget for H1, which did go through Finance Committee.
Thank you, James. So questions on that? Susan.
Sorry, me again. It's not about the budget. I'm sure the budget is absolutely fine. It was just an inquiry about our funding for the Healthy London Partnership. If my memory serves me, that's for a wide range of programmes, sort of connecting agencies around improving health outcomes, a lot of public health issues, I think. But I was wondering, however, what outcomes we might expect from this work for our population in South West London and how we get feedback on that.
Sarah.
Yeah, so this has been contentious for many years, the funding of the HLP, as we know, but we do actually benefit from this. I think we've talked about this in the past, and it does actually lead the work that we do across London on things like cancer and children's services and mental health. And Tonya knows a great deal because she links into the homeless work and the mental health work as well. And obviously, it also funds a bit of the primary care. It's less money than we have had in the past, and what we have been doing previously is to bring regular updates from HLP, so that what they do is they produce a report on, I think, a quarterly basis, and then we will bring that along to the governing body as they start to produce those. I think for the past 12 months, because of the pandemic, we haven't really been running business as usual in the same way, but we have still had the costs associated with this because of the staffing. But what we have done is we've worked with those staff to redeploy them where we need to into COVID response. So I just think it's worth making people aware of that. But once we get back into a more usual way of working, we will continue to receive reports back into South West London from the London-wide work that is going on. And I'm sure that someone like Tonya could talk about some of the positive work that they do. But I would suggest that some of it has had to be paused a little bit during this period.
And Tonya, it looks like you're ready to talk about some of the positive work.
Yeah, I mean, I actually do quite a lot of work at HLP, and both in mental health and homeless health. And actually, it's about the Once for London. So what can we do once for London? So a couple of pieces of work I've helped lead through HLP is like the London mental health dashboards, the Section 136 pathway. So actually, it's and they're very focused on that Once for London. They don't, they absolutely, every conversation we have is how we can add value, not duplicate or not do things that should be done locally, but that Once for London. So I am quite a strong advocate of it, and actually, particularly in the world of mental health, where it's about the wider mental health family and having the conversations across London. But that very clear programme that is this Once for London, I think is key to their success.
Thanks, Tonya. Any other questions on the finance report or the proposed budget? No. I mean, I think I would just take the opportunity, James, to say incredibly well done for the work you've done on finance across the system in this last year. There couldn't have been a much more challenging context, and to come through with the surplus position is really remarkable. So well done. I mean, I know it's not just you, but all the teams that have contributed to that. It is a really great piece of work. Can I come to the governing body then, because Finance Committee have approved the budget for the first half of this year. We need to just formally agree that recommendation here at the board. So can I check with people we're happy to do that? Yes, good, that is approved. Right, straight on to Susan to talk about the Primary Care Committee.
Yeah, I think this is just a report of our last meeting. It's pretty self-explanatory. I just wanted to bring your attention that a bit like one of the earlier items, we've been considering extensions of a number of contracts for a further year. The reason for this has been people not being able to give time to that because of the pandemic, and they want a bit more time to think about the future of the services. So we've approved those proposals for a fixed period, but we've also been assured that that plans need to come back to us so we can see them for March 22. So we're not in the same position next year, because that's the risk, isn't it, that we continuously push back. But I think there's some great opportunities to do some work, to learn from the pandemic about, and also to look at things from a South West London basis that Mark's been facilitating. So that was just to raise that one particular point.
Thanks, Susan. Any questions around the Primary Care Committee report? No? Okay, back to you, Susan, because I think you're deputising for Pippa to go through the...
I'm competing with Matthew for airtime today, aren't I? Right, so thank you. Again, Pippa just wanted me to highlight a few points. I think most of it's self-explanatory. Obviously, when we looked at the performance report, that was month 10. You've got month 11, I think, this time round, which Jonathan will go through. And we were just really noting the improvement in ED and ambulance performance, recognising that the elective recovery is still in progress. I'm sure Jonathan will update us further on that in his report. And that we're keen to understand the ambition of the South West London CEOs in the stretch targets for the recovery for this year. We also considered, given the varying performance of 111 in particular, we'd asked for a deep dive into emergency care, and we were able to see improvements, as we said, in A&E and ambulance performance. However, South West London 111 is still recognised as an area of requiring ongoing support. We heard about some significant amount of work that's going on with the aim to developing a sustainable service moving forward. I'm sure that also might be an area that we might pick up in the performance report. We're also pleased to see the significant improvement with the annual health checks for those with learning disability. And at the same time, need to congratulate all the hard work that goes on in primary care. And also in primary care and in the mental health arena, the challenges that people face in doing the annual health checks within the mental health forums. I mean, it's a complex issue, much more complex than for the learning disability. And we noted the challenges clinicians are facing and the barriers they're working to overcome with their clients. And finally, just to note that we received an update on the work of the acute COVID programme, and we were given good assurance that feedback from carers and patients are helping to shape the way forward. So I think those are the main points that I wanted to highlight to the governing body.
Thanks, Susan. That's really helpful. I guess just to pick up the issue of health checks for people with severe and enduring mental illness, that is an area where we have had some difficulties in South West London in terms of hitting the targets in the last year or so. We did look at that in some detail on Tuesday at our South West London Clinical Leadership Group, where we have senior clinical leaders from across the system, and Tonya came and gave us a report on where that's at, but also the quite comprehensive action plan to improve that position. I mean, clearly it's been very challenging this year, where we haven't wanted to bring in our most vulnerable patients into practice to have the full physical face-to-face health check, and people have been reluctant to come in, but it was somewhat reassuring to see the work that's being planned for this year now to recover that position. So that was very welcome to see that in that context. So thank you, Tonya, for that. Shall I ask for any questions on what Susan has flagged up and anything in that report at this stage before I then come on to Jonathan? Liz.
Yes, hopefully Jonathan will be picking this up, and Susan has already referred to it, but we had quite an extensive discussion about 111 yesterday in our pre-meeting with Susan, so just to flag up that we'd like to come back to that later on the agenda.
So, Jonathan, let me hand over to you. I mean, the performance report, so QPOC have been through month 10 performance report. I guess the key question is, any new issues emerging from what we've seen in month 11? Anything that you want to flag up to the board particularly, and maybe you just want to pick up where we're looking at the 111 issue, because that's been flagged up a couple of times there.
Okay, thank you very much, Andrew. So I think to sort of build on your specific question about progress between month 10 and month 11, then I think we continue to see in progress around elective recovery of diagnostic outpatient and inpatient services, trusts returning to higher levels of business as usual and getting patients treated. So that's really encouraging to see. I think having met with all the key decision makers around this, I also got more confidence about recovery around breast screening, which I know is something I've reported to this board previously as an area of concern. So those are the areas that are probably evolving slightly between month 10 and month 11 in terms of what's reported. Given your steer, I'm going to take the report as read, but to just talk then about the 111 piece and the concerns that have just been raised under the previous item. So just to set a little bit of a context around that. So call volumes are significantly higher than we expected. We had planned for a significant increase, but even above that, they are higher, and they're 20% higher than the national planning assumptions. And the pressure, where it used to occur in the afternoons and evenings, is now pretty constant from the sort of 6 a.m. onwards through the course of the day. And I think it would be fair to say that it feels like there's increased primary care demand also coming through the 111 route at this point in time. So we did invest, as I think I've reported previously to the board, considerably in our 111 service to try and respond to some of this, because we saw some of it coming, not all of it coming, but some of it coming. And I would say that our provider has not recovered as rapidly as we would have wanted them to in terms of a response to that ask. So that's something we're continuing to monitor on a weekly basis. We're continuing to monitor how they're filling the staffing pipeline, staff shifts, which are a key part of this, their productivity, the quality of the service. And we very much encourage them to focus on the call abandonment rate, because that's really important, because then if people don't get their call responded to, they will go and access another NHS service. And a high level of clinical validation. And against both those metrics, they're doing better than they are against the 60-second standard. And as I say, the reason we've chosen to focus on those two is because we want to make the best use of NHS services and not have people moving unnecessarily around the system trying to access care. And in terms of the second point, it's about a quality service from 111 and ensuring people end up in the right care pathway going forward. We've also got 111 working much more closely with the GP federations across South West London in terms of the clinical assessment service, and I think that will add some resilience going forward. It's also true to say that I think we're close to agreement with the regulator on how we may be able to proceed when the current contract comes to the end, and we'll happily update the governing body on further progress on that when we next meet. But that would be a significant step forward that would allow us to find a way through from some of the challenges we've experienced over the lifetime of this contract. So I think that's probably hopefully a helpful summary, Andrew and Liz and Susan, who've asked the questions about where we are at this point in time against this challenge, doing all we can, recognising actually the scale of challenge across all 111 providers is significant across the country. So I think there's a context around that. And something else we tried to build in for a while now is a resilience partner to work with Vocare and the provision of these services. That's proven difficult to secure because of the pressures on all 111 providers at this point in time. But we continue to monitor. I think we have a plan, as I say, that I'm happy to update more on when stakeholders have been involved and informed about that at the next governing body meeting. And we're doing everything we can through the remainder of this contract to ensure that there's a focus on the key measures of quality and access that we think are most important. So I don't know whether I've covered that, but I've tried to give a fairly comprehensive answer, given that was the focus of the questions.
Thanks, Jonathan. Liz, did that answer your question?
That was really helpful, thank you. I think just two further points. One is that, of course, 111 is, from a patient perspective, is one of the first points of contact with the NHS at a time when people are often feeling stressed and concerned. And therefore, if it isn't working as well as it should, then that is difficult from a patient perspective. But also, because 111, it seems to us to be such a key component as well of the scheme to try and divert level 4 attenders away from A&E, and therefore if the 111 isn't working as well as it should, it then seems to make it more difficult to actually achieve teaching people to use A&E in a different way, or preferably not at all. So perhaps through SESG, we could have an update next time on what is happening on that, using 111 to divert people into other pathways and away from A&E, because I guess that's our other area of concern if there's a weakness here with 111.
So just
Thanks, Liz.
comment.
Yeah, Jonathan, why don't you respond? And it may be as well as part of the performance update at the next board meeting, we just pick up where we've got to specifically around 111. That might be helpful for us to see as well. But Jonathan, back to you.
Yeah, so I completely agree. It's really important, a part of the patient pathway, and I didn't talk at great length about the 111 first piece and where that's heading. I would say actually Vocare have responded pretty well to the implementation of that. There's some sort of key strategic questions about how far I think we're going to encourage people to use 111 first nationally, but I think they have responded well to working with our local acute trusts around setting up the right services, and through the work that they're doing with GP federations around the clinical assessment service as well. I think given the increased focus on clinical validation and trying to get the right patients to go through to the emergency department, because what we want to ensure is the right patients are being referred onwards to hospital. That's another reason why we've chosen that as one of the two key metrics that we're monitoring on the 111 service at this time. But very happy to come to the group you're talking about, Liz, and talk about it in more detail, if that would be helpful, to sort of try and flush out where we are on this issue and what our plans look like, and brief people actually on the significant investment we've made to try and shore up performance at the point in time.
And Charlotte, were you wanting to come in just specifically around work with that group?
Yeah, so Liz, I think it's definitely something we can talk to you about. We've actually, we're just in the middle of an integrated communications campaign about 111, and we've done some patient experience sort of work with patients in A&E. So we can definitely share that at the next community engagement steering group, but that's something we're really working hard at.
Thanks, Charlotte. And Karen, let me bring you in.
So this is probably for Jonathan and Tonya. I was just interested in the IAPT performance. We've got referrals going into IAPT, but performance unfortunately going down, and a comment that we're unlikely to meet the end of year target. And we know, don't we, from COVID that the expectation is that the pressure on mental health services will grow. So I just wondered whether you could just talk about how we'll meet some of those challenges given the performance of IAPT at the moment.
So Tonya might want to comment in detail, but I think it's worth saying that we're still the second best performing of the 5 parts of the capital. So there's something around context, I think, that's helpful to hear on that. And there's also, as the report alludes to, in one borough, some information reporting issues that we need to sort of land and get on top of as well. Also, the target moves up every year on this, and this was a long-term plan target set before the pandemic. But I think you're right, Karen, that it's going to be, given the growth we've already seen in mental health attendances through emergency departments over the last couple of months, it's going to be an ongoing area of pressure, and it's something I know that Tonya and the Mental Health Forum are very closely involved in. But there's more to do, but I would want us to set the context. Actually, we're still doing pretty well in comparison with many other parts of London. But I'll probably pause there, and Tonya may well want to add.
So we actually have done a demand and capacity piece of work and aligned the SDF money and the MHIS money to ensuring we have sufficient capacities to meet the long-term plan requirements, 25% access in IAPT. I think it is a bit of a volatile target at the moment as it beds back in and as services open up again. We haven't seen a spike in referrals, and I think there is something around as we open up further, and particularly as our emotional wellbeing hubs for staff are set up, that we're really encouraging people to come forward to IAPT. So I get the bit about performance. I don't think we flagged it as a particular red flag. We just need to keep a watchful eye on it. I think it is that bit about capacity. Have we got the right capacity to meet a demand that we don't actually quite know how it's going to present yet? And I think that's the bit that we need to keep a real close eye on. But I think I'm assured that we have the right modelling and we have funding for the service. I think it's just how is it going to present, and how will that impact if we do get a particular rush or stepped increase in a short period of time.
Thank you, Tonya and Jonathan. Susan.
Yes, it was just really to move on to the RTT and elective agenda. Could you just remind us, Jonathan, how the trusts are working collaboratively to respond, which are some significant challenges around RTT and the backlog in general?
Yeah, so we've got a long-established acute provider collaborative, which of course Matthew is a key part of. So Matthew may has his hands just gone up. May well want to comment on that, but that brings together providers to talk pretty much on a daily basis at different levels, be it chief exec or coup or medical director or etc., about where we are. And we've, just to give you two sort of current illustrations of how we're working together which are sort of stretch targets that we would plan to put into our planning submission. So the work that's taking place at Queen Mary's Roehampton to provide a modular build there to treat something like 10,000 day cases a year, again, is something that we've built into the system to try and ensure we make the most of NHS capacity. That will have a significant impact on waiting lists and how we manage services and what we need from the independent sector, etc., etc. And also building on the work we've done for the last few years, but setting a higher goal about the number of patients who are moved with their support and agreement between providers to access care in a more timely way. So what was called the Joint Referral Unit is now the Demand and Capacity Unit, and there are a number of specialties where the waiting time is better in one trust than another. We will try to work with patients to move them so they can access the service, or where more appropriate, move the clinician or move the kit, the diagnostic kit or whatever it might be, to ensure people get access. So overall, our overall waiting list remains stable at this point in time. We're getting very close to business as usual activity levels. Indeed, some trusts are over business as usual activity levels and are putting additional initiatives such as 6-day working into Croydon to add to their day case capacity. So actually, I think we're working incredibly well, and that's reflected in the performance where referral to treatment times still have a long way to go to get back to where they need to be, but they are overall improving over time, as is our diagnostic performance too, and we're not seeing the waiting list grow, and we're in a significantly better place than lots of parts of the country on patients who waited more than a year to access treatment. So that would be my summary of where we are at this point in time. So an awful lot of effort going in from trusts and primary care and others, but also a lot of progress being made, I think.
And I will come to Matthew, but Susan, let me just say something about that from my perspective as well, because I chair the South West London Clinical Leadership Group, where we have all the acute trust medical directors and kind of borough CCG chairs and a cast of others. We've been quite heavily involved in working with the elective programme in overseeing this work and making sure it's being done appropriately. So the elective programme that Jacqueline Totterdale, the Chief Executive George's chairs, I sit on that programme board. I can see the work that's going on, but I also know how much clinical input there has been in looking at the backlog, in terms of thinking about how we effectively deal with it, but also in looking at the risk of patients sitting on the backlog and waiting. And there's been a lot of what we call clinical validation of the waiting list to make sure that we prioritise those patients effectively and get those with the greatest need seen first, which I think is a really important element of what we're doing. The other thing I would say is that we've got clinical networks set up for those most challenged specialties, and they are joint led by a secondary care clinician and a primary care clinician, which means that for those specialties, we're focusing across the whole end-to-end pathway for patients, including thinking about what is being done at the point of referral to get those patients well prepared and well worked up so that their journey through the system is quicker, but also to make sure that we get the appropriate patients flagged up at the start of that process. So I think there's really good work being done. It's very encouraging to see the clinical input into that as we work as a system. Matthew, can I come to you?
Yeah, thanks, Andrew and Susan. Just a couple of brief additions, because I'd endorsed entirely what Andrew and Jonathan had said. The couple of points I was going to make is I think you should be positive about two aspects of this. Firstly, the principle, and secondly, the practicalities. So in South West London, I've worked in lots of different systems across the NHS. The principle of joint working, collaboration, mutual aid, however you want to describe it, is, I'd say, more strongly held in Southwest London than other places that I've worked by some margin. And in the current climate, I think that's allowed us to do a whole load of things that others are hoping to do but aren't quite at the point of being able to do them. So I think the principle is there because it's part of the way that we have collectively worked, and that precedes some of the people who are currently on the pitch, and I suspect will continue past, because I think it's part of the culture of how it works in Southwest London. I think that's important to say. However, that doesn't treat patients. What treats patients is practical things that actually make a difference. And so we are now, as a group of providers, working, as Andrew says, we have networks. So we've got, for example, a gynae network, a urology network, where we are working together to try to make sure we maximise our activity, reduce waiting times across the whole piece. Another demonstration of that would be SWL, where we've demonstrated that over many a year, and also just in response to some of the challenges that we are seeing in Southwest London at the moment. St Heliers got some estate challenges, as we know, that has required them to reduce their theatre footprint for a period. Southwest London has stepped into that as a collective, the acute providers, and we've now had some theatre lists, what we now call Epsom at or St Helier at Croydon. So they come across, use our facilities, work with our staff and our systems, and is a good demonstration, I think, of the collaborative working. So it is not perfect. It's still going to take us a long time to get through the backlog that's been created by the pandemic, but I wouldn't want to be working anywhere else, either in a principle way or a practicalities way, because I think that is it's very strong on both levels, if that's helpful, Susan.
Stop there, Matthew, you couldn't say anything better. Right, any more final questions for Jonathan on the performance report, or can I move us on? Okay, so that's noted. Liz, you've got your hand up.
Yes, sorry, it took a while to click. A couple of points, if I may. One is that Bruno was going to raise, but he's had a power cut, which was around the dementia diagnosis, which seems to have been considerably lower. And particularly Kingston and Richmond, and Kingston historically the diagnosis rate was lower than expected. So Bruno has asked whether there could be a bit of discussion about what the thinking is underlying that and how that can be addressed. And the second point I wanted to pick up, which is a brief reference at the end of the paper to the CAMS crisis in Southwest London. Now that feels like it is a huge topic, which probably needs coming back to, but just at the moment a brief outlining of what this phrase encapsulates and what is being done to address this CAMS crisis. Thanks.
So let me suggest that the issue around dementia diagnosis rates in Kingston and Richmond is a level of detail on what's going on at the borough. I wonder whether we want to just kind of pick that back up with the CESG and just kind of let you know outside the meeting what's going on with that. I think probably more pertinent, the general question of how we're doing with CAMS as a whole across Southwest London. Tonya, do you want to just give us a sense of what's meant by that and what we're doing?
I can only apologise. I think there's a word missing from that sentence. It should say crisis pathway. So I think if you read the sentence, it should say crisis pathway. So I can only apologise for that. So, and of course, there is lots of work being done on the crisis pathway for CAMS. But that, we generally know nationally that there is an increasing pressure on CAMS, both in crisis presentation, but also through ED, etc. So I'm happy to do it, but I just wanted to assure the governing body there isn't a particular crisis in CAMS in South West London. It was just more relating to the pathway.
Okay, so let's not have a big discussion about CAMS then. I think if it relates to the wording, we can just change that, can't we?
And then in terms of the dementia diagnosis, I think you're absolutely right, Liz. The performance through COVID sort of tracks what we saw pre-COVID around some of the differentials in boroughs around performance. I think it's fair to say that this is an area that we need to look at. We haven't looked at in depth yet, because I think of the challenges around shielding of older people, care homes, not access to care homes. Now that lockdown is we're coming a little bit out of that. I think this is a time now for us to do, as Andrew said, at a borough level, and more of a deep dive in the dementia diagnosis for those boroughs where it's not at the performance level yet.
Thanks, Tonya. And then final comments from Jonathan.
Just to that point, Liz, just to add to what Tonya was saying, I think it's worth noting as hopefully access to care home settings improves. We're starting to see an improvement in performance, and you can actually see that in the report. So collectively across all boroughs, there is an improvement, and that's something that I'm sure Tonya and colleagues will be working hard to try and build on and sustain as we move forward. So it's been very difficult for all the reasons Tonya has given, but actually there is an upswing in performance in all but one of the boroughs, and let's hope we continue to see that month on month going forward.
Thanks, Jonathan. Right, I'm going to move us on. So I think we've noted the performance report and some really good questions about that. Obviously, we will continue to see the performance report in its various iterations through the board because it's a standing item. And I know that's something the Quality and Performance Committee focus on in much more detail than we can do here. Remuneration Committee hasn't met since the last governing body meeting, so we haven't got a report from that. So that takes me straight on to the next section, which is the South West London OD and workforce strategy, which is here for approval. Karen, I wonder if you could just set out just a little bit about how it was developed, who's contributed to that, and just what the headlines are. I'm taking the whole thing as read, so I'm not expecting you to go through it in any detail, but over to you, and then we can have a bit of discussion and then hopefully approve.
I wonder whether it's easier to take both documents, Andrew, because we've also got the taking action on equality, diversity and inclusion. Actually, they're linked, so if I explain how we've developed both of them, it may be sensible. So we have worked for some time to obviously merge the 6 CCGs into one, and wanted to make sure that South West London was a great place to work, and both documents are the recommended priority actions to take in order for us to achieve that goal. And you'll see it's certainly in the workforce strategy, there's a range of aims that we're trying to achieve as well, and you can see those from caring for our staff to making our workforce more representative of the communities we've served. So we've tried to link what we're doing to those aims. We've developed them across the organisation, so we've developed them with trade unions. With the EDI programme, we held a series of listening events. Board members will be familiar with the events across the world that made us relook at how we were focusing on equality, diversity and inclusion within the CCG. And we met with our teams across the organisation to look at their experiences towards EDI, both within our organisation and outside, to think about the actions that we would take. And certainly the whole of the action plan that you have with equality, diversity and inclusion is one that we've agreed with the people that came and talked to us. And then just one final thing, because I know that you want to give some time to talk. It's really important that we don't lose focus on either equality, diversity, inclusion or on workforce. So within the workforce strategy, we're suggesting we develop a workforce report that we bring back to the governing body to keep a track on the outcomes that we set and the things that we want to achieve. And in the section on workforce reports, you'll see that we want to set some outcome metrics and outcome targets to achieve that. And then can I just do one thing on terminology? So when we, in both documents actually, you'll see the term BAME written. At the time that we wrote the documents, that was an accepted abbreviation for Black and minority ethnic groups. The position in the NHS has moved, and we will extend that to record the whole of the words rather than the abbreviation now. Just an important thing, I think, because there was certainly a view that we were shorthanding equalities by using that terminology, and we certainly don't want to do that. So they're here for approval, Andrew, and I'm happy to take any questions or any comments that anyone has.
Thank you, Karen, really helpful. So why don't we focus on the ODM workforce strategy first? So are there any questions or comments relating to that? David?
Yes, thanks, Andrew, and thanks, Karen. Lay members, we had a discussion yesterday on both of these, so I'll start off and Susan may well add to that, because I had a number of comments, but of course she's not here. Look, I mean, I think overall they're really good and comprehensive strategies. So I think anything we're saying isn't about saying, look, we don't think they're good. They are good. They are good. The couple of things on the workforce first, we thought was probably more clarity in terms of what are we trying to achieve on this, and that particularly that bit around the expected outcomes and also by when. I think we thought that was probably missing from this, and probably would contrast that with particularly with the equality and diversity strategy, because in the appendix 1 of that document, you've got sets out very, very clearly what we're trying to achieve by when. And we thought that if we had something similar to that in the workforce strategy, it would be just easier for the board to actually, in a sense, on one page, to see exactly what we're trying to do and by when. So as I say, it was clearer in the equality strategy than in the workforce one. So I think that's really important. And then I think the other overall comment was really about how are we going to keep oversight and on both of these. And I think you're suggesting that that comes direct into the board. And again, we just wanted to be clear of that, because unlike everything else, we've got a committee to go through. So if we're saying that will come into the board, then I think that's very helpful, and that's something we would support. So I think it was, perhaps I'll stop there, and Susan may well want to add to that as well.
Thanks, David. I mean, I think what you're suggesting is there's nothing in the strategy that you're not happy with. It's more about wanting, I guess it builds on what Karen was suggesting, which was creating a report that comes back to the board. You'd like to see that kind of fleshed out, maybe in the same way that you've got in the appendix to the EDI strategy, in terms of what we're going to be, what that report is going to comprise in some way.
Yeah, absolutely, Andrew, because the strategies, I mean, there's nothing wrong with what, I mean, we wouldn't pick out anything in the workforce strategy and say we don't like that or it's wrong or in a sense something's missing. But actually, there's a lot of words there, and if we can get the words translated into something which is, much more punchy and in a single page, then I just think that will help the board when we come back to being able to monitor and review it in the future.
Yeah, so just to say, I think the difference is one's a strategy and one's an action plan. We do have a delivery plan for the workforce and OD strategy, so I can just review that and send that round if that's helpful. That will give you, I think, David, what you want. I'll see if I can put it on one page. It may not be on one page at the minute, so let me have a quick look at it. But we do have that for the strategy, so we can share that.
Thank you. And Susan?
It was just a point I've already raised with Karen, really. So for my sins, I'm the freedom to speak up guardian, and one of my duties when I read the job description was not only to respond to issues, but to ensure that we as a an organisation have a culture which encourages and enables people to speak out and to be heard, and just that sort of cultural emphasis, I think, would be helpfully embedded in that strategy. I suppose it's there. It's just trying to make it clear that it's also about not what we're going to do for others, but how we're going to enable them to help us. That it's a two-way process, because we can learn from people who feel confident that they can speak out, and that positive as well as difficult challenges that they're facing. So
yeah, I agree with that, and I think we're at the moment looking at the staff survey actions, and we'll come back to the governing body with the recommended action plan, some of which may be a staff and management charter that begins to pull out the expectations both from managers and staff, and how we'll make sure that people are supported to do things like that. I would just say that we're doing that already. So the culture is changing to do exactly what you've very helpfully suggested, Susan, because the whole approach to equality, diversity and inclusion has been a very interactive listening events, making sure that we understand what the real issues are, making sure that people are supported to talk where they want to. So for some people it's events, for some people it's one-to-ones, and then again the approach that we're taking to the staff survey action plan. Too easy sometimes, I think, to write an action plan that encompasses everything, or you think it should. We didn't want to do that, so we've been talking to our teams around the directorate responses we've had to the action to the survey to understand much more around what the real issues are in each of the directorates, and using an interactive tool to be able to do that. And certainly the feedback, I've run them in my directorate, I know all the directorates have as well. The feedback that I've had from my directorate is that they really value the fact that we're having those very, very open and honest conversations about the good things that we do, but equally the things that we need to change. I think it's an ongoing area that we're going to have to consider, but I'll bear that in mind, particularly as we have any of the kind of the OD parts to the work that we do, but equally the staff survey and how we encourage that, how we actively do that together.
Thanks, Karen. Sarah?
So I just wanted to stress how seriously we take this as an executive team, because also we have to recognise that this is a group of staff that seem to be going through continual change in the environment that they work and the roles they have. And I know that although some people thrive on that, many people become quite anxious about the future and what that means. So we need to keep our staff on side. We need to make sure that it is a great place to work in South West London, that they want to work in South West London, and we take that really, really seriously. I just wanted to stress that, and to stress the impact of the environment that we're currently working in on those members of staff, and how difficult it has been for them over a continual period of change, I think, in commissioning in the NHS over a number of years, which still carries on.
Thanks, Sarah. So I think there's three kind of actions that I'm hearing. One is for Karen to circulate the delivery plan linked to the strategy so that the board members can see that. The second is, Karen, that you're working on a report to come back to the board so that we can monitor progress against those actions. The third thing is we reference the staff survey, and I know we are setting up a task group to look at that, which I don't think has met yet, but myself and Susan are on that, and there will be actions that come out of that we report back to the board as well. So I think that's where we're at with those pieces of work. Is that right?
Mm-hmm. Okay. Yeah, task and finish group meets I think on the 25th of May.
Yeah. Okay. So with that in mind, can I ask the question whether we're happy then as a board to agree the OD and workforce strategy? Is that a yes? Yes, that is agreed. Thank you, Karen. I think that was a really good piece of work. So on to the EDI action plan. Are there any specific questions on that from the board? No, I mean, I think you've covered a fair bit of that in the more general conversation, having talked about the two together, Karen. Again, I just think this is a really good piece of work, and I think the actions set out in there are really important, and it'll be good to see those at the board as we work through them and see them delivered. So, can I ask the board then? Are we happy to agree the EDI action plan? That's a yes. Good. So that is agreed. Right, on to the next section, which is public questions. So we didn't have any questions submitted in advance of the meeting and haven't had any come in during the meeting. So so there aren't any public questions for us to take. I haven't been notified of any other business, so I will draw the meeting to a close. Thank you everyone for your time and input. I thought there were some really good questions there and we had some really helpful discussions, and I just think the fact that we've been able to get through that in a timely way reflects the incredible work that people have done to get their papers into such good shape, but also the diligence of the board in reading through all that stuff outside the meeting so that we could really focus in on the key questions. So thank you everybody for your time, and I will draw the meeting to a close.
Thank you, Andrew.
Thank you.